Right. Good afternoon, everyone. Today I'm announcing the first of two media sector support packages to help media affected by COVID-19. Today's support package is a first step to provide immediate and urgent help for the media sector. It's well known that New Zealand's media sector has been facing challenges well before COVID-19, but the disruption from COVID has compounded the difficulties with significant losses of advertising. Without government intervention, we risk losing the skills and range of perspectives which provide important independent news and information that New Zealanders rely on, especially at times like these. So we've developed an immediate support package in consultation with the media sector. The first package focuses on initiatives that can provide immediate or near-term assistance. It's aimed at helping media in print, online and broadcast channels at national, regional and local community levels. The initiatives in the first package are reducing the costs payable by media organisations for transmission and New Zealand on-air funded content by funding 100% of Kordia and other television and FM transmission fees for 6 months, 100% of the AM transmission fees for 6 months, an 80% reduction in media organisations' New Zealand on-air contribution fees for the 2020-21 financial year. The government will also be purchasing central government news media subscriptions in advance for the 2020-21 financial year and encouraging government-funded agencies to increase the uptake of news media subscriptions. There's also a delegated authority for me and the Minister of Finance to approve targeted assistance on the advice of officials to ensure the support fits the different needs of the various media organisations that request it. And we also state a commitment to build on the local democracy reporting project, which has been trialled in regions around the country over the past 12 months, funding journalists to focus on reporting about publicly appointed elected officials or organisations such as local councils, community boards and DHBs. We see the further development of this work as part of a second longer-term strategy which will provide further support to retain journalists, regional and national news and current affairs coverage, including local news, maintain media plurality and make sure regulation is suitable. Further announcements on the longer-term strategies will be made in due course. We will work with media entities to make sure that whatever access they have to both these short-term measures and longer-term assistance is on the basis of their needs and future viability. The direct cost of this package is $50 million. Māori Television, Te Māngai Paho and the National Pacific Radio Trust have also been involved in helping shape the initiatives in this package as they're primarily Crown funded. They are not impacted to the same extent as commercially funded media. However, they could see benefits from the waiving of transmission costs and Māori Television could see savings from New Zealand on-air contributions. Officials are finalising the details of how media can access the support package. Intent is to make this as swift as possible. This morning I spoke to a number of media chief executives to give them a heads up on this package. They were thankful, but like me understand that this package alone will not ensure the sustainability of the sector. We will need to continue to work with them to design the second phase and importantly move swiftly if conditions change. Finally, I'd like to take this opportunity to acknowledge the work of the media in keeping New Zealanders up to date with news and important information during this time of crisis. It has certainly been appreciated by the public. I'm happy to take any questions.
Minister, where's the commitment that the government will prioritise advertising on local media rather than on Google and Facebook?
That is certainly going to be part, Tova, of the second tranche of work that we're looking at. This first package is aimed at immediate cash flow assistance for media companies. So that is why it's made up of the transmission fees and some of those direct conversations we'll have with media organisations. Certainly those conversations are being had about the second tranche of work, and already our Treasury has been in touch with our counterparts across the Tasman to work in tandem with them.
Can you make a commitment that that will be coming? Because that was one of the things that across the board media bosses were quite.
I can make a commitment that that's certainly going to be one of the important discussions as part of the second package.
The $11.1 million discretionary fund, will state broadcasters be able to access that as well?
Yes, they will, because I think most of the conversations around that will be about bringing forward government advertising spending. Only one entity could do that in a large way. The issue with that is that in our conversations directly with the media companies, they're all in different positions, and we wanted to make sure that while we might be able to assist with cash flow, we also wanted to make sure that there was prudent spending of taxpayer money.
Have you had any indication from media bosses about how many jobs this will save?
No, I haven't. They were very short phone calls this morning that I had. Look, I want to stress that this is the first package, and this alone will not be able to cure all the problems that the media sector has. I think some of the long-term solutions will certainly be part of the discussions, and of course some of the commitment that the government will make towards the second package. Great.
There doesn't appear to be a lot in here for print, but particularly stuff. Are they on their own, or do you expect them to make?
No, they're not. As I say, I've spoken to a number of chief executives. I will be having bespoke conversations with those entities about how they might be able to access some of that more flexible funding. And again, it depends on the nature of the entity and some of those discussions that they'll be having with officials to figure out how that can be of assistance to them.
Would you not agree, would you not agree though that the package is very weighted in favour of broadcasting?
Well, I think that's...
Can you explain how it's going to help print and digital?
Well, I think that's because of the nature of the cost and immediacy that we want. It's expensive for transmission costs for the likes of broadcasters, and it is immediate relief that we're trying to get through. The flexibility that we have within that $11.1 million of funding will allow us to have some of those bespoke conversations with specific entities to make sure that if we can assist them with initiatives like bringing government advertising forward, we might be able to advance that.
Do you not believe then that there's a need for urgency to help out print and digital entities?
There's an urgency to help out everyone. The nature of the funding envelope is weighted purely because of the nature of the cost of some of the media platforms. In this case, being transmission, it's 6 months worth of television, FM and AM frequency fees, which off the top of my head is roughly $20 million. That's the cost of transmission fees.
Hundreds of our print colleagues have lost their jobs already during the COVID crisis. So where is the additional support, the triaging for the print industry?
So as I said, this is the first package of 2 media support packages. There are some fundamental issues about the structure and nature of the media sector, which were present before COVID, that we want to make sure are addressed when we take a look at the second support package. This isn't about making sure we prop up failing businesses. It's about making sure that we can support the important function of journalism in New Zealand, and I think that's what we need to make sure that we are focusing on in terms of the second package as well.
Suggestion that the government would get behind a Stuff Me merger, for example.
Look, I'm not going to go into any of those hypotheticals at the moment. We've had discussions with nearly every media entity. I want to tell you they're working very hard behind the scenes to try and make this work. But those discussions have been commercially sensitive, so a lot of the answers of that type that I'll be giving today might not necessarily be helpful, but if we need to take policy action, I'm going to have to keep a lot of the information that has been given to me commercially sensitive. Sorry, in front of me here.
That online advertising though, it would provide immediate relief, which is what you're saying. So why isn't it in this first package? Why are we having to wait for this?
Because it takes time to effect those changes. We're having discussions with some of those platforms very soon, and it's not something that can be turned around fast. If we were getting pressure to make sure we did something in the short term to have an immediate adrenaline hit for the sector. This is what this is, while we make sure we continue to work on the second package, which will look at issues like competition and like issues around online advertising as well.
So, Thomas, are you willing to let some of those large legacy media companies fail and lose hundreds of jobs?
Look, at the end of the day, some of those decisions aren't in our hands. We've spoken to some of the owners of media entities, but not all. And so some of those decisions won't necessarily be made by us, but some of the principles that are driving actions in the short and the long term are media plurality, making sure that we support the function of journalism, and making sure we can retain as many jobs as we possibly can.
So you accept that some
I'm not going to be talking about that openly, Thomas. because some of that might draw on information that I've been given on a commercially sensitive basis.
Drawing a line saying that
One at a time.
drawing a line
Craig.
saying
What is the state of TVNZ's finances right now?
Well, I'm not going to go into that again because that's commercially sensitive information.
Sure, but you-
Sorry, Andrea.
Staff is the largest employer of journalists in the country and also has the largest number of local newsrooms, yet it receives the least from this package. Can you explain your thinking on that?
I guess, again, a lot of that comes down, if you're going to put it in the context of the overall envelope, Andrea, is transmission costs are high. There's also the conversation that I've had with all the chief executives today that there is the ability through that $11.1 million appropriation within the $50 million to have bespoke conversations with every entity about what support might look like for them. So I can't give you exactly what the support out of that might look like for staff, but I'm aware of the nature of it and the importance of it in the media environment, and we're continuing to have discussions with them. Sorry, Andrea.
Did you look at the Australian model where they're requiring entities like Facebook to share revenue with the media companies?
Yes, we are going to be looking at, and that discussion is going to be part of the second package. And as I said at the outset, our Treasury officials have been in contact with their relevant counterparts across the Tasman to make sure that we can work with them.
So you're drawing a line in the sand saying there will be no bailouts for media companies, even if they are on the brink of
Our
collapse.
principles are making sure that we support media plurality, making sure that we support the function of journalism, and making sure that we support as many jobs as possible, as well as this media support package. Most media entities, if they are able to, have accessed initiatives like the wage subsidy, etc. So we're trying to do as much as we can in the short term to allow us to give us some time to have some of the wider discussions that were plaguing the media sector before COVID happened. And I think if we're all honest with each other, some of those discussions need to be had.
Following on from Thomas's earlier question though, sorry, can I just finish that line of questioning? Following on from Thomas's questioning, you are willing to let media organisations fail?
We'll deal with everything on a case-by-case basis as it comes to us, but our principles are making sure we support plurality, jobs, and the function of journalism. We're going to... we could stay here for hours and throw up every hypothetical about what might happen. A lot of those hypotheticals I won't answer because they are hypotheticals, and I would be answering on the basis of commercially sensitive information that has been given to me. I have to work in good faith with some of the chief executives of this company in order for us to make sure we've got a long-term and sustainable media. Sorry, Janae.
Thank you. In terms of subscriptions, I note that 1.3 million has been allocated for the 2020-2021 financial year. Just by way of context, how much was spent in the 2019-2020 year?
I'm not sure about it, Janae. I can come back with the other
Is
information.
that 1.3 an increase, or was it basically just the same as what's already been?
I don't know the base figure. I would hope it's an increase, but the feedback that we had from operators of smaller subscription services was that the government wasn't pulling its weight to make sure, government departments weren't pulling its weight to make sure that it paid for its fair share of usage of their media. Sorry,
Minister, you touched on it briefly, but could you detail the impact this will have on Māori media?
Yeah, look, in a technical sense, obviously they have cordia transmission costs as well, and may to some degree have New Zealand On Air costs that they would have when they get funding from New Zealand On Air. Just like every other media entity, they will be able to access that relief, as well as some of the work that Minister Mahuta is doing with the Māori media sector shift before COVID, being part of the conversations that I had around the second package, around the look of a long-term sustainable model for media. Māori media will obviously have to be pretty central to that.
The subscription fund, is that ring-fenced for actual subscriptions, or all New Zealand media now, I think print media, and digital media operate some sort of donation model. Will you be allowing that to be used for donations as well?
My understanding is it's more for the smaller type of subscription services.
And the $11 million fund, what is that for? Is that the media boss picks up the phone and says we're in trouble?
Look, as I say, every conversation that we had with media entities had a certain similarity to it, but they're all in different financial positions. Initiatives like bringing forward government advertising spend could come out of that, and certainly that was the tone of some of the conversations I had with some of the managers and chief executives that I've had today. Again, we want to make sure that we're about being able to assist cash flow for some of those entities if that's the position they're in, but also around viability of an entity, we need to make sure that that money is spent prudently. So they will have to speak with Treasury and Ministry of Cultural and Heritage officials to make sure that we get that right.
How long do you think it will last for?
Sorry?
How long do you think it will last for? You get depleted pretty fast looking at
Well,
how much media
it
comes
depends
in.
on what the particular needs are. Again, we've designed this package in consultation with media companies, and they've given us, some have given us an idea of how much government spending on advertising that I've had in the previous 12 months, and that's helped us get to some figures to have available for this, again, this first and short-term support package.
How
So, TVNZ.
How likely is it, you think, that going forward in the next couple of years, we're going to see a smaller media market in New Zealand?
I'm not sure if you can guarantee smaller, but I think you can guarantee. No, I think what you can guarantee is different. It all depends on how particular media companies might want to change their business models. But again, I think there's a natural level of function of journalism that our government wants to see to make sure we've got local journalism, national journalism, investigative journalism that most companies that are in the media now, to be fair to say, are struggling to provide. So if there's some way that we can do that through beefing up what is the local democracy reporting model at the moment, and it's in its very early stages, it's only a 12-month pilot run last year, but bringing that to a head and seriously investing in that is one of the things that we're looking to commit to as part of the second media support package.
Can you give any further examples of bespoke solutions aside from the government advertising spend?
Oh, look, there were plenty. Again, I might be giving away some details that particular companies might be in. But if I've chosen that one because that came through as a rich vein through almost all companies that have had government spending.
There's an enduring perception that the government's quite happy to bolster TVNZ and RNZ and let the rest of the sector take its chances. What's your response to that?
I think it's wrong. Certainly pre-COVID, we had a look at the challenges that the media sector had, and we saw it as our responsibility to make sure that public broadcasting continued to be strong, given the challenges that the competitive market or the open market was having. COVID has obviously changed that because the advertising revenue challenges that most commercial media players had pre-COVID were obviously a lot sharper as we go through COVID. That is why we are here now with a $50 million package in the short term to give the media sector an adrenaline hit, to make sure that we have the time and the ability to have the wider conversations with the sector as a whole to see how we can make the media sector more sustainable.
Can you please explain why you're cutting and subsidising RNZ's transmission fees when effectively the government's paying those anyway, aren't they, via RNZ?
Yes, that, to a degree, I'm not sure how much that is within the overall package of transmission fees, but there is a degree of money go around there. But they are, again, another transmission company that might pay fees to Cordia or themselves, so I'm sure Treasury will sort that out.
What's the point in that when RNZ hasn't lost any funding during COVID?
Well, it's not about necessarily losing the funding. The parameters of that is if you pay a transmission fee, you don't have to pay for it for the next 6 months.
Paying it anyway for RNZ?
And I'm sure Treasury will sort that out. My understanding is that it's a minimal amount of money.
The advertising spend isn't necessarily new money, it's just bringing it forward. It's more of a cash flow measure rather than a bolstering measure.
That's correct.
Is there any sense that you might want to boost the level of
That was one of the things that was talked about in some of the consultation that MCH did with media companies in the lead up to this package, and I think it's one of the issues that we'll look at for the second package.
Mood of those media execs this morning?
It's a challenge, and we spoke to them possibly about a week and a half, 2 weeks ago as we were putting the package together, and for some things had moved on significantly. I think, as I say, while they welcome the package, they know that there's more work to do to make sure that they can have a sustainable future, and I think it's no one is not susceptible to the challenges as in every sector, but they're trying their hardest to make sure that they can keep their businesses sustainable and people and jobs.
Is the RNZ TVNZ merger still part of your thinking as part of that second tranche?
Let's say that's on ice We've asked PricewaterhouseCoopers, who are doing the business case for that, to continue that work. They're going to deliver it in July, I understand. While it's on ice, it doesn't necessarily mean it's dead. I just think there are wider issues for us to contend with at the moment with the wider sector. But again, I think making sure that we have a strong public media is extremely important. But that decision, which was at the forefront of our minds pre-COVID, is not necessarily right in front of us right now.
Please tell us how much more the government has spent over the last year on advertising on the likes of Google and Facebook and social media versus local media, and how much that's increased perhaps over a 5-year period.
The advice that I've given is that the government ad spend, and it might not be total, but I think it's pretty close, is about $110 million for the year 18-19, I believe, is the figures that I've been given. And about 30% of that was to online platforms. The rest of it was television, radio, print, outdoors, etc. Again, we're digging into those numbers as we get into the second tranche, because we need to answer the question about how much of an effect precisely is Google and Facebook having, not just with government advertising spend, but across the board, to make sure that we're informed when we look at the issues such as what the Australians are doing at the moment.
We expect that second tranche, though, as you say, for media companies, this is moving really quickly
Yeah,
at the moment.
I can't give you an exact date on that, but we are aware of the urgency.
Weeks or months, budget?
I would say weeks. Please don't hold me to that, but again, we're aware of the urgency.
So that's right. Is that roughly $33 million a year goes to Google and Facebook and advertising spend?
Of 110, I think it was about 110, so I think it was about 30%, something like that. I can get you the figures, but again, I don't think it was precise, but I think it's pretty much in the ballpark for government advertising spend.
More than half on advertising on Google and Facebook than you are on the media support package.
Pardon?
More than half the amount on advertising on Google and Facebook in a year than you are on the media support package.
And I would stress that this is the first tranche of 2 media support packages.
Second tranche, will the budget be roughly the same, or will there be more, or is it more of a kind of structural?
I would like to be more ambitious. I think, we see this as an adrenaline shot for short-term support. And while we are yet to have the conversation with the powers that be, I think if we're dealing with structural issues with the media, then I think we have to think seriously about if we look at upgrading that local democracy reporting scheme, being serious about it.
Minister, what's been the cost of the new information thing on Facebook that pops up at the top that the government has done, the sort of official COVID information?
I don't know the answer to that question. I can get that for you.
This media package was expected last week. What happened? Why the delay?
I wouldn't necessarily call it a delay. I think I said in the select committee last Wednesday that it would take about a week. We got it through a committee yesterday, and I'm here on Thursday announcing it.
Outside of the 11.1 million, which hasn't been assigned yet, how much money is specifically going to go to Stuff, which is the country's largest employer of journalists?
Well, we can't answer that yet. Again, those bespoke conversations have to be had with that particular entity and other entities to give both Treasury officials and the Minister of Finance and me some assurance that it's appropriate.
Is there an option to extend the amount of time that those transmission fees would be
Yeah, there is. So we've said 6 months. As I said to the Chief Executive this morning, my crystal ball isn't that flash, but we'll keep an eye on the situation for next 3, 4, 5 months and gather about that particular initiative when the time comes.
Would that form part of a more long-term measure to keep the industry going?
I think at this stage, the Minister of Finance might not necessarily be happy if I committed to that, but it's certainly something that we're okay to look at in 4 or 5 months' time.
Can I ask you a personal question? I know you've been a minister for a while and an MP for a long time, but you were also a journalist once. How bizarre is this, or how hard has it been for you to hear about the concerns of the industry and address this support package?
They say once a journalist, always a journalist, and I might get myself in trouble with my current colleagues about that. But I fundamentally believe in the importance of the function of journalism in New Zealand. We might not like getting harassed standing here all the time, But it's an important part of the democratic process. And we see that and we understand that and we need to be held to account. And to a degree, we think there has been a bit of market failure in the last couple of years, which is why we saw it fit to bolster public media. COVID came along and has changed a lot of things. But, you know, I'm not going to talk about jobs, but I think the function of journalism in this country is extremely important. We're a small country, and even though I think we might think we're doing a great job, being asked questions about what we're doing is extremely important.
Probably wouldn't call questioning harassing either.
Pardon?
Probably wouldn't call questioning harassing.
It depends on which side of the podium you're on. Thanks, everyone.
Kia ora koutou katoa. It's day 29 of COVID-19 Alert Level 4. We'll start as per usual with Dr. Bloomfield.
Thank you, Prime Minister. Tēnā koutou katoa. So today we have 2 new confirmed cases and 1 new probable case of COVID-19 to report. However, there is actually no change in the total number of COVID-19 cases in New Zealand, which remains at 1,451, the same as yesterday. Let me briefly explain. There were 3 cases we reported yesterday who were confirmed cases off the Greg Mortimer ship that had been, where people had been repatriated from Uruguay. However, we understand that their original testing was done in Uruguay, and we are checking with the authorities there as to whether they have already reported them to the WHO to make sure that the World Health Organization totals are accurate. So to report, again, just to reiterate, 2 new confirmed and 1 new probable case. Our laboratories processed a record 6,480 tests yesterday. So if you look at the new confirmed cases, less than 0.05% were positive. And we've now processed 101,277 tests for COVID-19. All the cases we're reporting today are linked to existing cases. Sadly, today I have 2 further deaths to report as a result of COVID-19 infection. A patient has died who has been very unwell in intensive care in Dunedin Hospital with COVID-19 since 7th of April. She was in her 60s and had an underlying health condition. While her family had not been able to visit her over the past few weeks, arrangements were made for them to be with her last night as she passed away. The second death is a resident at Rosewood Rest Home in Christchurch. This man in his 70s passed away in the hospital level wing of that unit last night. He was not part of the group that had been transferred to Burwood Hospital. The man had an underlying condition, and while he had tested negative for COVID-19, he was considered a probable case based on his exposure and symptoms. And as I have said before, these probable cases are treated as if they are positive and managed in the same way, and we are including them in all our statistics, including our mortality statistics. My sympathies go out to the families of both of these people, and once again we are reminded of the serious threat that this infection poses to individuals and our communities. Today there are 8 people in hospital with COVID-19 and 1 person is in ICU in Middlemore Hospital. There are still the same 16 significant clusters, and 4 additional cases have now been linked to those clusters. Some brief comments on health services under level 3 in advance of heading into that alert level. So hospitals remain open for emergency and acute care, of course, and I encourage all people to seek acute care for whatever their condition through either Healthline or their GP or at the hospital. Some elective services, including surgery and radiology, will be provided under Alert Level 3, and more detail will follow on that. In aged residential care, only family visits for palliative and compassionate care reasons will be considered, and that will be on a case-by-case basis. General practices, of course, will be open as they have been through Alert Level 4, and they will be continuing to conduct virtual consultations as much as possible. If you have symptoms of COVID-19 or respiratory symptoms, please seek help through Healthline or by calling ahead to your regular doctor. Community pharmacies remain open. Dental services may provide urgent face-to-face appointments under Alert Level 3, but not routine dental care. Community midwives will continue to do the fantastic work they do with pregnant women out in the community, using virtual means where possible, but also face-to-face. And there will be an allowance for some face-to-face services for physiotherapy, podiatry and optometry and so on, where urgent care is required, but they will continue to provide services as much as possible virtually. And finally, community mental health service appointments will continue to be done by virtual means or by phone where possible, face-to-face appointments if necessary. And you'll have seen the Minister of Health just announce that he's asked me to do a quick stock take around all our district health boards on the processes they are using to distribute PPE to our providers based in the community, so we can get an idea of what PPE is going out, how quickly they are responding to orders, and how any concerns are dealt with. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. Later today, the Director of Civil Defence Emergency Management, Sarah Stewart-Black, will give an update on what our civil defence groups across the country have been doing to support vulnerable New Zealanders. She'll also be joined by Police Commissioner Andy Costa for a briefing. The work that's been done by our civil defence group may be going unnoticed to the vast majority of New Zealanders while everyone is in their bubbles, but it is work that keeps people who would otherwise be without fed, warm and well. We have been working hard to ensure that we're meeting need where it exists, which is why yesterday we put another 30 million into our civil defence group so they can keep providing food parcels, household goods and accommodation where it's required. And that follows the immediate assistance, you'll remember some time ago, of $27 million put in to support that work. And so on the ground, 16 local civil defence groups are doing what they do best. They're coordinating across all government agencies, organisations including NGOs, iwi and community-based groups. While COVID-19 may seem like a different kind of emergency to what we've dealt with in recent years, like floods and fires, the role of civil defence is very much the same, ensuring communities, individuals, families and whānau have the support they need. There is an 0800 number for every group that people can call if they are out of supplies or struggling to get basic food. They've been providing emergency accommodation, a stopgap service, before they are referred to MB's temporary accommodation service. This is business as usual for them, but they also now have powers activated by the state of national emergency in support of the COVID-19 response, as you're all well aware. So far, that's been used for things like closing roads to prevent vehicle access to backcountry to stop activities that might result in rescue activity. In Taranaki, they have moved on freedom campers. In Canterbury, they've requisitioned a car park for use as a community-based assessment centre. Coordination is a role not to be underestimated. It's what helps get what is required to those who need it most. And I do want to pass on my thanks to the amazing work that's been done by those civil defence groups in our local areas. Short word on hunting. While food parcels keep families fed, we know that in many parts of New Zealand, hunting is also a part of providing for many people's families and whānau. You would have seen that decisions have now been made for this activity alert level 3. Hunting can go ahead under alert level 3, so long as you stay in your region, so long as you stay in your bubble, and we're asking that people please don't put themselves at risk of needing rescue. So that means don't use quad bikes, off-road motorbikes or any motorised vehicles for the purposes of hunting. Dock land is closed for tramping and other activities and also for hunting at level 3. On private land, you'll of course need landowners' permission. Hunting is an important part of life for many New Zealanders. In many places around the country, it fills freezers for the months ahead. It also rids farmland of pests. And these restrictions allow for it to happen safely and in a way that minimises the risk of losing the great progress that we've made, and also is in keeping with the principles that we've set out for Alert Level 3 around travel, around bubbles and around activity. We've also had discussions with Fish and Game about the duck hunting season. As many of you will know, the season is gazetted in advance and was due to begin on the 2nd of May. Cabinet was concerned that under the Level 3 guidelines for hunting, some people would be excluded from the season, perhaps in part because they lived at too great a distance to where they may need to be. There was also concern that if it started soon and people weren't able to take part, it would end up being a shorter season for some people. For that reason, the duck hunting season will go ahead in the second weekend after New Zealand moves to Alert Level 2. The season, once it gets underway, will be extended to make up for the delay. I know this will be disappointing for many, but we recognise that opening weekend is quite a social event for many people, and we still must reduce down contact at level 3 as much as possible. This decision means all those who usually take part in duck hunting will be able to, just on a slightly different time frame than otherwise. I also want to be clear that hunting will be able to resume normally at level 2, once we get there. just today is not that day. On Saturday, Anzac Day, I will be one of many New Zealanders who will take part in an initiative called Stand at Dawn. The RSA has encouraged all of us to commemorate our service personnel by standing at the end of our driveways or near our letterboxes at 6 a.m. to stand at dawn. I know how hard it will be this year, our first Anzac Day in history, where services have been cancelled due to COVID-19. But that doesn't mean we can't show our support as a collective. As dawn breaks, we can stand at the end of those driveways and together in silence and pay tribute to those we should never forget. We can still take time to pause, reflect, and pay our respects to the people who have given so much to us. This year we are calling for all Kiwis worldwide to stand at their letterbox, their front door, their balcony, or their essential place of work at 6 a.m. on April the 25th. The official dawn service broadcast will be on RNZ National Radio at 6 a.m. and will include an address by the Minister of Defence and Minister for Veterans, Ron Mark. If anyone wants to find out more details, I encourage you to visit standatdawn.com. And so in the spirit of recognising those who have been a part of our COVID-19 response, today I want to thank the New Zealand Defence Force, past, present and future, for all that you do to keep peace, to keep us safe, to help us recover from natural disasters, to help our Pacific neighbours, to reflect our strength of spirit across the world, and more recently, for your work on COVID-19. Some 60 expert planners and logistics personnel have helped with central government operations such as health and police centres, as well as regional emergency operations centres. More than 600 have helped to manage isolation facilities and distribute care packages to those in need. This comes alongside usual work such as search and rescue and disaster relief. I'd like to make special mention of the crews from 5 Squadron and 40 Squadron of the Royal New Zealand Air Force, who have also been flying relief flights in support of our Pacific neighbours in Vanuatu, Fiji and Tonga, who have been hard hit by Tropical Cyclone Harold. We, as always, are grateful for your service. Thank you. I'm now happy to take your questions.
People have recovered?
The number of people who have recovered has increased by 29 and is now 1,065.
Been in touch with that Dunedin,
Yeah.
that family connected to the Dunedin fatality. They were on the radio this morning saying that they've been given false hope from these press conferences by saying that the person was stable.
Was stable.
Yes, so I haven't personally, but I know the medical officer of health has, and we, through our comms team, cleared the statement I have made today with the family. So yes, yesterday, prior to yesterday, the information I had was that the person who has subsequently died was in critical condition, and yesterday it said stable, which reflected the fact there had been no change. But I am very sorry, because I think that from that story that did create some anxiety and concern for the family. So I'm sorry that that happened, and I'm certainly happy to be in touch with them personally if they would like to.
We've also talked about in future maybe distinctions that talk about people being in ICU without necessarily the breakdown of their status within ICU. Because in this case, perhaps the health terminology will mean different things to different people, and no one wants to create any kind of extra additional distress for families, as obviously has been caused in this case.
Those Burwood
Clarify
patients.
the case-by-case basis on which family members will be able to visit their loved ones in hospital?
Sorry, do you mean under current?
Under level 3.
Under level 3, yes, there is some new guidance going up on our website around this, and so that will be at the discretion of the senior clinician if a person does have COVID-19, and there will be provision for, if the clinician feels it's safe, there will be provision for a family member to visit, and PPE will be provided, and its use will be instructed, so that will keep the family member safe.
No changes under level 4, is that right?
Sorry?
There are no changes in that
No
regard?
changes under level 4, that's an intention under level 3.
Why did, you were speaking before about under level 3 if someone's in palliative care or end of life care allowing visitors. The website says that visitors from the extended bubble with no suspicion of COVID-19 will be allowed one at a time, but that doesn't specify that it's just for palliative care.
You mean that was in aged residential care facilities that I was talking about? The arrangement in aged residential care is still no visiting except in the circumstances of whether it's a palliative situation, and then compassionate visiting will be organised through the facility manager.
In hospitals, people will be able to visit?
The visiting policy is different in hospitals for people without COVID-19 anyway. There is an ability under Alert Level 3 for individual family members to visit.
On that Burwood group, are you able to give us an update of how many remain either confirmed or probable cases and what their conditions are?
I don't have that information, but I will seek out that information and we can make that available.
Certainly it is the case, isn't it, Dr. Bloomfield, that there are obviously a number around Rosewood who have been identified as having contracted COVID-19, and devastatingly, of course, you're seeing then the impact of that on a vulnerable community. And so when we saw those initial deaths, it's obviously indicative of the fact that when it reaches those vulnerable communities, it is devastating. But there were a number who were positive.
Is that still the case, though, that I guess we spoke a couple of weeks back with you and you said it is possible that we'll see more deaths? This is still quite or have we passed the worst bit with these group of people, or is it still a really big concern?
Well, if you think about the unit in which the infection happened and the people who were transferred to Burwood, these are people with quite advanced underlying conditions anyway. And so we have seen further deaths, as I alluded to, might happen, and there may well be others. As with the death today, even when there isn't a positive test, as there was in this case, we are being inclusive to make sure that we are capturing any death that could be COVID-19 related. But this is the group that is the most vulnerable and tends to have the worst outcomes from this infection.
How common is it that we get these negative tests? We haven't kind of heard about that too much before.
We talked a little bit in the beginning about it.
I think right from the start I've talked about the fact, and that's one of the reasons that we are thoughtful about when we're using testing, because a negative test, and for example, sometimes we've seen cases that are still classified as probable, even they may have had repeated negative swabs, and that doesn't reflect a problem with the testing, and it I think underscores our inclusive approach for making sure we are capturing and treating any probable cases as if they were a case and acting accordingly.
Yeah, in the front.
Prime Minister, you mentioned yesterday that provided that they collaborate with police and operate appropriately, that there's largely iwi-based checkpoints, that you're okay with them. When we move to level 3, will you still be comfortable with these checkpoints operating?
Yeah, to the degree that they are working with civil defence and police, because keeping in mind it is only the police and civil defence who are lawfully able to stop people. And so I'm comfortable with the message I've received from the police that they're working well with communities on the ground where some of these checkpoints have existed to make sure that they are operating within the law and with the best interests of the community at heart.
To you, Dr. Bloomfield, people have approached us asking, people in the Māori community have approached us asking why there isn't data on ethnicity testing by region. Why is that?
We just haven't done the analysis, but we can provide that. We provided an updated analysis in the last few days by ethnicity and by region, and we can go further and do the breakdown by region, acknowledging that in some of the regions the numbers are relatively small, so the breakdowns may well, there will be maybe small numbers in some of those groups. But yes, we're happy to do that.
So continuing on with that then, and publishing those and making those publicly available, that is in the works, and if so, when might that happen?
It can be done because when we publish those laboratory data, we are linking them to the NHI number, and now we don't get 100% match, but we get a 96% match, and then the NHI carries information about age, ethnicity and so on, and the ethnicity is prioritised, so it has Māori prioritised. So we can do that. I'll talk to the team when I get back there today.
Prime Minister, should New Zealanders be able to get a refund from Air New Zealand rather than just credit for cancelled flights, particularly those who are now in hardship?
That's not something I've had raised with me, so a bit difficult for me to make a statement off the cuff. I'm sure Air New Zealand have been doing some work around, what is fair under these current circumstances. If you wouldn't mind, I wouldn't mind taking a look at the issue before just giving you a response.
Do you think it would be fair for Air New Zealand to tell people they're not entitled to a refund or a credit because their flight is still departing?
Sorry, is it reasonable for them to say that they've... it's obvious to people that many of the flights in question are not still departing.
But if they are still departing, Air New Zealand has in some cases said
no refund, no credit, because
Yeah.
they're still going.
Again, I would want to just go and look at some of the circumstances under which this is being applied. We are asking people, though, to be fair and reasonable under the circumstances. I know that there will be many people who will have trips booked that just aren't possible to undertake now. So if you wouldn't allow me just to go and have a look at some of the policies that are being released on that front. Yeah, Andrea.
Lots of elderly people who are spending unnecessarily long amounts of time in hospital because hospitals won't test for asymptomatic patients, but the rest homes won't allow them to return until they've had the test. So can you clear that up and give some clarity on what the situation is?
Yes, and we did speak. I spoke to this at some length yesterday. So we've had and are having ongoing discussions with the Aged Care Association. What we agree on and what happens is any older person who's going into residential care or is returning because they've been in hospital, who is symptomatic, and there's a low threshold for testing, is tested. And anyone who is positive does not go back until they have recovered and have clinically been determined to have recovered. But every resident going in or returning goes into 14 days of self-isolation and is tested if they develop symptoms. And the whole point of that 14-day period is that if they did have COVID-19 and had been exposed, I should say if there is any history of exposure, they are also tested, symptomatic or not. However, the advice of a range of professionals, including, you may have seen yesterday, the New Zealand Microbiology Network, is that routine testing is not helpful because it is a point in time in asymptomatic people. And this goes to the point I made earlier on, that actually even when we think someone is a probable case with a clear history of exposure, the test can still be negative. So we do not think routine testing is indicated.
Just come in front and then I'll come over the Toba.
Germany is making face masks compulsory in public, and Auckland Transport's asking passengers under level 3 to wear them on buses and trains. Where is the consideration at for whether New Zealand will see these sorts of measures under alert level 3 and 2?
So at this point, we're not recommending people use face masks routinely. We don't think it is an important part of our overall measures. The most important parts are the physical distancing and hygiene and other safety measures. And of course, maintaining the bubbles. That's the really critical thing. This morning, actually, quite early, myself and colleagues were on a call with our British counterparts to share experiences, and this was one of the issues raised. Like us, they are carefully watching the evidence, and as their chief medical officer has said, you can find very high-level specialists on both sides of the argument. So again, I think if people want to wear a mask, they should know how to use it, but we don't think at this point there is any indication for routine use of masks in public.
What I do just want to urge is that it is no supplement, it is no substitute for social distancing. So when it comes to public transport, we will still ask people to try and keep their distance, keep seats free, sit further back from other people if you're able. All of those basic measures we're asking people to maintain all the way through these alert levels.
On the masks, isn't it wise that we err on the side of caution while evidence is still being evaluated?
At this point, we don't think that that's the important thing. The important thing is where we have emphasised our key messages, and those have served us well to date and will continue to. If people want to use a mask, they can, but they should know how to use it. Recalling again that there are disadvantages of using masks as well as possible advantages.
Dr. Bloomfield, would you mind expanding on the correct use and disadvantages of use as well?
Well, the correct use depends on the type of mask, but it is very important that you put it on and keep your hands away from your nose and mouth, and they usually hook behind the ears. The challenge then, and as we have all found, is we tend to unconsciously put our hands up to our face, and often if you're not used to wearing a mask, for example, you don't spend day after day in an operating theatre, the tendency is to then keep putting your hands to your face, and when the mask is wet, including as we have seen recently down in Burwood, when the mask is wet, then it can transmit viruses, including COVID-19. So the key point here is meticulous hand hygiene, and of course, most importantly, not going out if you're unwell.
Yeah,
on that.
Dr. Bloomfield, some private hospitals have raised concerns that they're not being reambushed for staying open at full capacity during level 4 lockdown. They've cancelled electives, obviously, and lost a lot of income. Are steps being made is there progress being made to reimburse them for that, or will they be out of pocket?
Yes, there are. Prime Minister, did you want to talk to that? Because I know Cabinet has looked at. We certainly have been having active discussions with private hospitals, because we're keen to see that capacity, should it have been needed during this period, if our number of cases had gone up. And so we've been in active discussion, and we have asked each district health board to get in place an arrangement with their private hospitals in their areas.
So they won't be out of pocket, essentially.
Well, that will be a discussion. Yes.
One thing I should, just as a general principle for our health professionals and those who are working within the health sector, and this includes in primary health care, is that we haven't made moves to reimburse lost revenue, because there are businesses around the country who have lost revenue during the response to COVID-19. What Cabinet has been very careful around is making sure where people have incurred COVID-related costs, and that's been something that we've responded to for our GPs, for instance, with the fact that they may be doing consultations online or over the phone and haven't been able to collect fees for that, or where they've been undertaking testing. We wanted to make sure there was nothing that stopped them from undertaking testing, for instance, for a returning non-resident or the like. That's where we've been wanting to make sure we're covering those costs. But there are many who have lost revenue during this period, and it's not just in the health sector. Jackson in the front. Jackson in the front.
The Prime Minister, the Australian Prime Minister Scott Morrison is pushing for the World Health Organisation or another investigative body to have inspection powers to be able to enter countries and trace the source of outbreaks. Have you had any recent discussions with your Australian counterpart? Has he raised this idea with you?
No, that's not something we've specifically discussed.
Open to this idea, or to hear more about it?
You would have heard me share yesterday just the general principle that, of course, I think the entire globe will wish to learn from the experience that we're all in the middle of right now, and we, of course, in New Zealand would be very open to that. There are things that all of us, of course, want to make sure that we've learnt, and particularly from best practice, but also that includes the speed at the beginning of outbreaks and also determining source. So I think we're open to that, but that again isn't something we've been particularly at the forefront of.
The Kohanga Trust, National Trust has advised all Kohanga to be closed during the level 3 lockdown. Do you support that?
Actually, I've seen from Kohanga Reo, but also some from within the ECE provision, who are making decisions based on what they see as the best interest for their personal workforce and their community. And we trust them to make those decisions. Of course, our overarching message is still, if you can work and learn from home, you should work and learn from home. And that, of course, includes our children and young people. What we're wanting to make sure, though, that is there is provision for those who are unable to do that, but that can be done safely within ECEs.
Whether the government has ruled out using Palantir's technology, and what type of technology they were offering?
My understanding is that there's no current work underway in that regard and no plans to.
What percentage of children are you expecting back at school next week?
Look, at the moment we don't have anything definitive to give us a sense of numbers. I've only heard anecdotal feedback from the likes of some high schools and primary schools, but very small numbers. But from what I've heard, the numbers that are registering for return are relatively small. But that is anecdotal.
The Health Minister has now ordered a rapid audit of DHB's PPE distribution, and the Auditor General's investigating. Are you still willing to state, as you've done before, that we have really good distribution systems?
We've said we've had good provision and good stocks. We've always been wanting to make sure that we have distribution performing at the level we expect right now. One of the areas where we think that there has been a need to improve has been from within DHBs then out into those community health providers. That's particularly where the Minister of Health is focused with this audit. Mikey.
Thank you. Some economists are saying that helicopter payments, one-off cash payments to Kiwis, would help stimulate the economy. Is that something the government is seriously looking at?
Look, what we've been very careful around is just acknowledging that we're in a point in the process where we are working through the range of options for making sure that we are continuing to help our economy to recover. And of course, the first best example of that has been the speed of the wage subsidy program. The Minister of Finance has always been very quick to point out that we've got to make sure that what we do works. There's certain points in a recovery where payments like that aren't necessarily successful or create the stimulus you want. But we haven't ruled things in or out at this stage. We are focused though on doing what will help our economy recover the fastest.
So you're broadcasting
Again, we haven't ruled anything in or out, but we are focused on what is going to have the biggest effect in terms of supporting people's livelihoods and getting our economy recovering.
So you're broadcasting
Yeah, right on the back.
Just to follow up, your commentary then sort of pointed out perhaps some of the problems with a universal payment. Are you saying that you don't think it is necessarily the most effective way to stimulate the economy?
No, at this point I'm actually not saying anything specific at all, because we are wanting to work through all of the options that are available when it comes to stimulating the economy and ensuring our economy can recover quickly. You would absolutely understand though why something like helicopter payments at level 4 aren't especially successful.
Continue these daily press briefings when we go into level 3, and what will be the plan going into level 2?
I expect that we will change up the schedule a bit at level 3, in part because of course the House will be returning. And before some additional New Zealanders started tuning into press conferences daily, you'll of course recall that I had one with you before Parliament or the House sat on sitting days. So I imagine we'll return to a bit of a routine that factors
Do you
in.
think these daily press conferences have been helpful for New Zealanders that have been isolated at home?
That's probably for New Zealanders to answer rather than me.
Your broadcasting and communications minister said that he wanted to be ambitious with the second tranche of the media support.
That he wanted, sorry?
To be ambitious with the second tranche of the media support package. Do you expect that the second tranche will dwarf the first?
Oh, well, I do think that we shouldn't diminish or trivialise a $50 million investment in supporting broadcasting in the media, print journalism, things that people have been relying on but have been hit hard by COVID-19. This first package, though, and acknowledging that your industry is only the third really to experience direct investment through COVID-19, this is very much focused on something we can do immediately to provide immediate support. What we need to do beyond that is actually work on some longer term options.
Bloomfield, do you want COVID-19? Have there been any confirmed cases of COVID-19 relating to the 250 seasonal workers?
No, not at this point. However, what we are doing in Te Puke is one of our cases there has an association with although doesn't interact directly, but is involved with one of the hostels there for kiwi fruit workers, and we felt it was important to actually test all of them. And I've just spoken this morning with the medical officer of health up there, and that testing is happening apace and will be completed by early afternoon.
Why are they not being held in isolation until those tests come back?
Well, there's nothing to suggest there's any problem there, and of course they are in a sense in a big bubble, and that has been maintained through Alert Level 4. We're taking a precautionary approach here and testing them all. So I'll let you know the results of that testing when we have it, which will probably be at least some of it tomorrow.
Our contact tracing teams, will they be able to handle a move to level 2 when our bubbles get much bigger?
Yes.
Absolutely.
You'll see that we've boosted their capacity so that they can make 5,000 calls a day, and then we've gone even further to ensure they've got surge capacity up to 10,000 calls a day to help support contact tracing. That's in addition to the cases that our local health teams are already able to manage. So surge capacity is there and it's ready, and we'll continue to invest in our public health units to make sure that we get that gold standard we want. Ben, you had a question about...
Is the principle behind Radio New Zealand getting funding there, just the Oprah principle? You get a prize, you get a prize, you get a prize? Why does it give New Zealand money?
No, it's not.
Prime Minister, there was a suggestion as to provide perhaps some more financial support for those businesses who are not able to open under level 3.
As the Minister of Finance has said, that we have been constantly reviewing what's happening for specific businesses, the impacts of specific alert levels. So the wage subsidy, the tax changes have been particularly focused on those businesses who may have struggled with some of the short-term but immediate impacts on their cash flow. Now we're looking beyond and looking at what specific sectors and businesses may continue to be impacted at level 3 in ways that others are not. So that's part of our ongoing COVID review to make sure that we are responding as quickly as we can to some of the need we see. I have no announcements to make on that today, but it is a constant piece of work that we do.
There was a suggestion at the Epidemic Response Committee that one way of stimulating the construction industry would be allowing overseas billionaires to purchase land here and inject $5–10 million into construction. Do you see any merit to that?
Do you know, that philosophy has existed in New Zealand for a number of years, and it's never been one that I've subscribed to or believe actually achieves what people claim it does.
Do you have any update on recent community transmission cases? How long has it been since we had a new one? You said there were 2 yesterday and they weren't recent onset cases. So has it been a long length of time since we had any new ones, and what does that say about how close we are to elimination?
So my team's gone back through every case since the 1st of April to narrow down the ones where it's not entirely clear where the source was. We were down to 7 yesterday, and of those, even though they were classified as community transmission, it was quite clear where the person had been infected or the route back to infection, which was pre-lockdown. So we're down to just a couple where it's not necessarily clear, and those we may never know, but the important thing is, and one of those is actually the Te Puke one.
Yep.
So that's why we are doing that wide testing around it, just to make sure, first of all, that there's not COVID-19 that the person has caught it from the wider group, but also to make sure that it's not being transferred on. There's no reason to believe it is, and in fact the close contacts of that person have all tested negative, but we are just being doubly sure. So we're in a very good position.
How long it's been since we've had a new one?
I can't say exactly, but we'll find out that information and we'll make it available.
Essentially just like 2 known chains of transmission that we haven't broken, that we know about.
I think what this goes down to, and again, some of these cases, even of the others in that 7, we don't know what the exact link back was to. Of course, all our cases in New Zealand at some point have been imported. So if we were able to go back through manual means, we could find out where they came from. But one of the other things we're doing is we are asking ESR to do the genome sequence on some of these to find out what other cases they are linked to, and if they look exactly like the genome, for example, of the virus when it was in Iran, or if it had come out of Europe or out of China, because there are very subtle differences. So we're using ESR's genome sequencing capacity to also provide insights.
So at the moment, sometimes actually just a small handful really in recent times, and even then you can get a hint of what may have happened, even if it's difficult to pinpoint precisely what has happened.
Just a question for Dr. Bloomfield.
Nice use of eye contact to direct the question.
Yeah, I finally realised too. So, Dr. Bloomfield, just in regards to improving the capacity of contact tracing, the capacity and timeliness, on Sunday I think it was, you said you were confident that within a week we'll reach what you describe as the gold standard. Is that target still going to be met by this weekend?
But we're well on track, and the team I'm expecting a further report from by the end of today. There are 2 key things happening this week. One is our ministry team is working apace with getting the information system up and even further developed. But I've also got folk out visiting several of the public health units to do a needs analysis about what additional capacity they need, because actually the first recommendation in Dr. Aisha Varel's report was that the public health units need to be boosted. So we're out there and the funding's been made available, and we want to make sure they get the skills and people they need. Of course, we won't be able to pop them in within a couple of days, but it means that over the coming weeks we'll be able to increase capacity out in our public health units as well.
The gold standard is 80%, tracing 80% of close contacts within 3 days.
The KPIs of the real report.
That's one of the key indicators, so that's what we're aiming to get to. It will continue to evolve and develop, but by the end of this week we're going to have the platform there to be able to do the sort of contact tracing we need to do.
Just in the front.
Our GPs are telling us that anyone living in a crowded home or with a pre-existing health condition can be tested at community testing centres. Is that the case?
So the community-based assessment centres are for people who have symptoms, and either they turn up themselves or are referred by general practice or by Healthline. There's no need for people to go in if they are asymptomatic just to get a test, for example, because of their living conditions. So saying, there is some widespread testing happening across a range of workforces and settings by our DHBs this week and out in rural communities, and you've seen that reflected in the 6,400 tests that have been done, because actually the number of people with respiratory symptoms at the moment is almost record low, because we haven't been transmitting these infections to each other.
Right in the back,
We're down to just 3 COVID-19 cases. Do the modelling that the government have suggest that we're never going to get back up to double digits again? This is basically, we're here at single digits for the foreseeable.
There's no such thing as never, because it all comes down to our behaviour from here, and that's where that team of 5 million is so important. We do need to keep in mind all of the public health principles that we've been using and practicing to date: washing your hands, keeping your distance, staying at home if you're sick, getting a test if you're symptomatic. Those will need to be with us for a long time, so there is no such thing as never. I'll come, Derek, and then Gina.
As part of the gold standard for contact tracing, an end-to-end system where we can see the timeline of when the case first had symptoms, when they were tested, when the result came back, and when the contacts were traced.
So it's definitely an end-to-end system, and that's what we are setting up with a national view of that. We're still working through the exact indicators, because for example, one of the ones you talked about was understanding exactly when the onset of symptoms was, and this can be quite tricky, because often people will present several days or even a week down the track and they can't remember their exact onset of symptoms. So there are three key things we're wanting to do. First of all, get New Zealanders to get tested as soon as they get symptoms, or seek advice about testing. Secondly, get the test turnaround from swab to result as short as possible, and we know from our laboratory data that that's getting very good. And the third bit, and this is the critical bit, is identify and contact any close contacts within the 3 days and get them into self-isolation and test it if they need to be tested. So that's the sort of end-to-end process, and then make sure that they are staying in self-isolation. So that's the system we are setting up and want to be able to monitor and report on.
One of the things that's really insightful from some of the reports we've been having, even in recent days, you can see that we might have a positive test, and then our teams from the PHUs are going in to try and identify where the origin of that case was, and may then find that actually it was someone else in the household who was first symptomatic, and that might have been some time ago. And so even when we're producing, we might then test them or list them as a probable case. That data then won't be a fair representation of the speed of our contact tracing, because that person never presented and was only identified through the work that those PHUs are doing. So I think it's just important to keep some of that in mind. It's not necessarily always a linear process. Sometimes we're going back and identifying other cases as part of that investigatory work. But the fact that we can come down and tell you within a couple of hours of the cases that we've had that day, what we know of where they've come from, tells you that our PHUs are working very, very quickly.
Visibility across that system from infection to contact.
Yes.
To have that in one system, having that visible, it's critical to ring-fencing that whole chain of transmission.
That's where we want to be, but as the Prime Minister said, actually our public health units are very effective at doing this. This is their core business, and so it's not. This will help us have a national view, and particularly as we have had, where we've got clusters where there are people across the country, that's very important. But our public health units are very good at finding people and then getting them isolated and ring fencing, and they do this very effectively, and that's been a good part of why we have been able also to be in the position we're in now.
How prepared are you for a second wave of COVID-19 in New Zealand, like what's happened overseas?
We're doing everything we can to prevent New Zealand experiencing the second wave that we have seen in other countries, and that's why we're moving slowly, cautiously, confidently down through our alert level system. At the same time, we're very prepared, we're taking nothing for granted, but I'm confident with the path that we've carved ourselves, we should prevent New Zealand having that experience.
If this has already been asked, but how many of those probable cases have returned negative tests?
Of all the probable cases? Well, by definition, a probable case is one that does return a negative test, but the sense is that given the clinical picture and the epidemiological link, that this is a probable case and it is treated and managed as if it was a case.
Probable cases have not been tested, and we're just assuming they have.
No, some of them are not tested.
Yeah.
For example, where it might be a child and the symptoms were some time ago, the challenge of doing a nasal swab, it's not that pleasant, and also the likelihood of getting a positive test is low. But to be inclusive, we're including them in our probable cases.
We did have, for instance, an example of one of the patients in one of the aged care facilities whose family didn't wish for them to be tested, but we still considered probable. So there will be cases like that. Ben, we'll wrap up soon. So Ben, and then I'll come back over here.
Governments of the world are obviously encountering this huge coming fiscal burden, how to pay for all the stimulus packages, and New Zealand is no exception. Speaking to people in the Pacific and developing countries, as I've done over the last couple of weeks, reporting on Tropical Cyclone Harold, lots of fears that foreign aid budgets will be cut as a result of developed countries having less money. Can you confirm whether this will be ring-fenced in terms of next budgets?
I'm not going to get ahead of the budget, which will obviously be released not too far away. But what I would say is that New Zealand has always been mindful of our responsibility to particularly our Pacific Island neighbours in times of hardship and in good times. And it's no different for us now. What I would keep in mind is actually some of the aid projects that we would usually be engaged with haven't been as easy to continue to roll out. It's required entry into our Pacific neighbours within their borders, which has been limited. So it does mean that we may be seeing some of the reorientation of support into areas of need where we can actually facilitate the investment of aid and development funding.
Funding level should roughly be the same.
Again, I'm not going to get ahead of the budget process, but from New Zealand's values that when there is need, New Zealand does its bit.
Minister, this is a non-COVID question. Where are negotiations at over ihu mātau? Have they completely ground to a halt during this COVID response, or have there been ongoing talks that the government's been part of?
We certainly haven't gone backwards. And you'll remember that actually we were making very good progress before COVID-19 hit, and none of that progress has been lost. But as you can imagine, there hasn't been the ability to bring any finality or closure to that at this time, just because really that face-to-face contact and our ability to facilitate some of those negotiations has been limited. Okay, thanks everyone.